Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Esophageal motility disorders, there is a manometric classification. So first, let's look at the disorders of EJG. So first is the disorders of the EJG obstruction. So first is the type 1 achalasia. So type 1 achalasia. So type 1 achalasia, it is nothing but it is classic. Type 1 achalasia is classic. So the definition of the features is that it is an abdominal IRP. It is the abnormal. It is an abnormal IRP. That is 100% of the failed peristalsis. So 100% of the failed peristalsis is seen here. Next is type 2. Type 2 is with the pan-esophageal pressurization. The pan-esophageal pressurization, and this also has an abnormal IRP. So this is an abnormal IRP. So along with abnormal IRP, there's a 100% failed peristalsis. There is 100% of the failed peristalsis. And there is a pan-esophageal pressurization. There is pan-esophageal pressurization. Now let's look at type 3. So in terms of type 3, it is nothing but the spastic. So type 3 means it is spastic. So this involves the abnormal IRP. And there is 100% failed peristalsis. So there is 100% failed peristalsis. In the second type, it was a pan-esophageal pressurization. So in type 3, it is 100% failed peristalsis. It is failed peristalsis, and along with this, there is spastic contractions as well. There is presence of spastic contractions. Next is there is a pan-esophageal. There is pan-esophageal pressurization. So pan-esophageal pressurization, or there is a normal pressurization. Next is there is a DCI. DCI is greater than 450 mm Hg. So this was about the disorders of the EJG obstruction. Next is we move on to the disorders of peristalsis. So disorders of peristalsis. So here there is DES. So what is meant by DES? DES means it is a diffuse esophageal spasm. So it means diffuse esophageal spasm. And what are the definition or the features? It is nothing but a normal IRPN. Next is it is non-peristalsis. It is non-peristalsis. Peristalic, that is a spastic. Next is there is contraction of, so non-peristaltic contractions or premature contractions. Non-peristaltic contractions are the premature contractions. Next is the DCI. So the DCI is greater than 450 mm Hg. So next we jump on to the nutcracker esophagus. So what is the nutcracker esophagus? So in terms of nutcracker esophagus, there is a normal IRP. So there is normal IRP, and there is an increased duration. This is of the peristalsis, increased duration of the peristalsis, and there is a normal peristalsis. There is increased duration of peristalsis, there is a normal peristalsis, and the DCI. The DCI, it remains greater than 8000 mm Hg. So this was about the disorders of peristalsis. Now some important points. The DCI. What is DCI? The DCI is nothing but the distal contractable integral. So this terminology is an index of the contractibility vigor. It is nothing but an index of the contractibility vigor. So it is calculated as a product of the amplitude, duration and the span of the distal esophageal contraction. So it is calculated as a product of the amplitude, the duration as well as the span of the distal esophageal contraction. Next, what we have in line is the IRP. So what is IRP? IRP stands for the integral relaxation pressure. So it is the integral relaxation pressure. So this is nothing but it corresponds to the mean pressure. So it corresponds to the mean pressure and this is of the greatest post deglutive relaxation. This is of the greatest post deglutive relaxation. So this is in 10 seconds. This is in 10 seconds gap. This takes place in 10 seconds gap and is triggered at the beginning of a swallow. So this will be triggered at beginning of to swallow. So this is FMGE. To learn and grow daily like this, please do subscribe.